A major cash infusion for Ontario's healthcare system. The Trudeau government has finalized a health agreement with the Ford government, investing $3.1 billion over 3 years to alleviate what many doctors, nurses, and advocates have called a system in crisis.
We need to be able to show Ontarians and indeed all Canadians that the significant money we're investing to improve our healthcare systems is delivering real results and outcomes for them.
Real results in the form of more family doctors. With more than 2 million Ontarians currently without one, access to primary care has become a priority in the New Deal. Under the agreement, the Ford government has committed to spending money on adding hundreds of new family physicians to fill the major shortage, in turn freeing up space in emergency rooms and shortening wait times.
Rather than this 4 hours or 6 hours or 8 hours waiting, because I'm getting calls every day, let's knock it down to an hour. What do you need? Do you need more doctors? Do you need more money? What is it that you need?
The province will also be expected to modernize its health data systems, improve mental health services, and make it easier for internationally trained doctors to practice in Ontario. Critics say the agreement is long overdue. Ontario is the 5th province to sign on for its share of the $200 billion health accord Trudeau offered to provinces last year.
In Ontario, we're just signing now, why? Why? I mean, during those 12 months, you know how many people have waited for surgery? You know how many people have faced closed emergency room? You know how many people have lost their primary care provider? $3.1 billion can do a lot. With the government we have in place, there is always the worry that it will be the investors who will get rich.
Last year, the Ford government passed legislation to move some publicly funded procedures to private for-profit clinics, raising concerns about privatization of the public system. In an exclusive interview with Breakfast Television, the Prime Minister was asked if there are any conditions on the new funding.
We will look very carefully at how this was delivered, whether it made real differences, whether they hit the markers that the Ontario government has committed to hitting. There are checks and balances in this system.
Union leaders have crunched the numbers. They estimate the province needs to invest an additional $1.25 billion annually over the next 5 years to improve staffing levels and boost capacity. For City News, I'm Yazdani.